करती हूँ मैं, तो मैं घर आती हूँ तभी व्हाट्सएप देखती हूँ,
ओके।
अदरवाइज लाइक आई एम नॉट अवेलेबल ऑन व्हाट्सएप ऑल द टाइम, तो बहुत डिस्टर्ब करता है, तो इससे उसको डाल दिए। तो सुबह दोपहर शाम तो मैं देख लेती हूँ, हाँ।
ओके।
इट इज एन एब्सोल्यूट इमरजेंसी, कोई ब्लीडिंग है, लेबर पेन चालू हो गया है, तो डायरेक्टली भी कॉल कर सकते हैं। खाली रहूंगी तो टेक द कॉल, हाँ।
ओके।
या ओके, सो विल स्टार्ट विथ टुडेज सेशन। अच्छा, how many of you all want a normal delivery?
आई वांट।
You want, okay. कोई है जिसको नहीं चाहिए? सभी को चाहिए रहता है ना। If we can please ensure that your buddies are here, because I can see only 11, 12 of us here, out of which 3 जने तो हमारे टीम वाले हैं। तो प्लीज मेक श्योर दैट द एंटायर टीम इज देयर। अपने बडी को देखो है कि नहीं, नहीं है तो प्लीज कॉल करें उसको। आई विल गिव यू फ्यू मिनट्स ऑफ टाइम, हाँ। चेयर है जो कि यूज कर सकते। I'm waiting for you all to call your buddies so that we have complete number. Please check in the group. You will have your buddy's name. Unless until दोनों में से एक भी नहीं है, फिर कौन किसको कॉल करेगा? So I will just take little attendance. I will stop the share first. Okay. So let me see. Ritu Parna, your buddy is there?
Yes, ma'am. Divya is there.
Okay. Sabri, your partner?
तो मेरा पार्टनर तो यहाँ पे कोई ऐसे मेंशन नहीं है।
ग्रुप में लिखा हुआ था, ग्रुप में पूरा लिस्ट आया था।
मेरा नाम के साथ किसी का नाम नहीं आया था।
ओके ओके। दिव्या, मनस्वनी, लहरी, प्रियंका, पवित्रा,
Yes, my partner Ritu is here.
Malini, please ensure, Jaya, please ensure that your partners are there. किसका partner नहीं है? We are wasting our precious time with this, you know, because I want to finish things on time. Okay, now we have 15 of us. Okay. See, girls' responsibility starts from here. It's simple. Suppose you have to go somewhere and your child has not come. Suppose you have to travel to Kashmir for a holiday and he's gone to school, and it was that, you know, somebody will get him directly to the airport and he didn't reach there. So will you go? No, no. So likewise, it's the same thing, taking responsibility here as well. Now, these days we were actually talking about your pregnancy now, but there's another very important thing which gets ignored even in the doctor's chambers. Breastfeeding. We don't talk about breastfeeding in our chambers. We are not preparing our girls for breastfeeding. And after the delivery, breastfeeding is definitely one of those major challenges. And how to master natural birth. Right now, you're thinking that yes, normal delivery chahiye, but on that day, pain ho raha hai. The other day, I was actually shocked, you know. A patient comes and tells me, I said कि okay, admit हो जाओ, normal delivery का trial देंगे, will induce. So she said, if you feel ऑपरेशन करना है तो ऑपरेशन कर लो। ऐसे क्यों ऑपरेशन करना है? बोले फ्री में तो होना है, क्या फर्क पड़ता है? So because it is freely available in the government setups, so you are ready to even go undergo surgery. I'm still in a state of shock for the last 3 days. So please make sure that your sankalpa of a natural delivery is very, very strong. And the only why you need, my why I started this course was my brother. Now, why you want a normal delivery and why you want to breastfeed, each one will have their own different whys. No? Garbh Sanskar, 5,000 years old. A prepared mother births an empowered child. If you are only doubtful, everything will go haywire. Even your child will always have doubts. No? Your body already knows how. We just want to awaken you. Not even the body. Once we awaken you that normal delivery is any day better. Surgery is safe, but complications are more seen in surgical cases. Like when you undergo a normal delivery, the bleeding that you have after delivery is about 500 ml. But in a cesarean, it is up to 1 liter. So you're losing out on 500 ml of your precious blood also. So you will obviously have more weakness. And because there's so much of blood loss, so recovery becomes a little slow. So preparation, what? For easier birth and abundant milk. And medical science confirms all this. Hormones respond to what you practice now. No? बोलने से नहीं होगा, सोचने से भी काम हो जाएगा. So today, let's give our 100% and see how this magic will happen. Your breasts are already working magic. In fact, I would say that the changes in the breast happen even before the pregnancy test turns out to be positive. And as a doctor, we can actually see the nipple and say that this patient is pregnant. We see the Montgomery tubercles there, and we can diagnose a patient even without seeing anything else. So, and what's happening right now in your body? The miracle is already happening. So many changes are happening. The baby is growing how? Your heart rate, the circulation, the volume has increased, your kidneys are functioning in a different way, your ligaments are functioning in a different way, and your body's hormones. So even at 16 weeks, some girls will see the production of colostrum. You don't have to press your breast and see whether there is any discharge. Naturally, when you're sleeping, you might feel that your dress is a little wet, or even during the day. It could be from both the breasts or it could be from one breast. It is perfectly normal. If you have it also, it is normal. If you don't have it also, it is normal. So don't get worried. No. By 22 weeks, the milk ducts multiply daily and your breast starts growing in size. The changes start as early as, your conception. So what you should do, you should start wearing little looser bras and the next cup size bra at least. And by 32 weeks, your body is fully ready to feed. And now this colostrum, it is needed in very, very small quantities. बच्चे को दूध पिलाना है. First 2 days is colostrum. We don't have to give milk and no formula feed is needed by the baby. Have you ever seen an elephant feeding a monkey's baby? Or a lion feeding a cat? Though they are from the same family, they're not feeding each other. We humans are so called up there in the evolution ladder and we are willing to give any animals feed to our baby. Why? Don't you think it's a crime? It is a crime. So your baby's first vaccine is ready in the colostrum. That is the first milk for first 2 to 5 days. The thick yellow golden liquid, it is a liquid gold. Only 2 to 20 ml per feed is needed. That is a perfect amount. 2 ml. 2 ml is negligible. 1 teaspoon is 5 ml. 1 tablespoon is 10 ml. That is all that your baby needs. And modern proof is, who calls it baby's first vaccine? WHO calls it as baby's first vaccine. Now, in India also it is called as Amrit. Just a minute. No, sorry, girls. So, antibodies are the baby's first immune system. And only your colostrum has this. No formula feed, no top feed will be able to provide with this. Brain growth factors, first bowel movements are triggered by this, and it seals the baby's gut against infection. One simple thing that I will tell you, when the baby is breastfeeding, no, this movement is happening. So the upper palate is getting stimulated. And when this upper palate is stimulated, the brain development happens. But when the baby is bottle fed, this movement is happening, the palate is not stimulated. So there is a difference in IQ level of babies who are breastfed and who are bottle fed. Yeah. Now the sacred first hour, the breast call, this is called the golden hour. In the first hour, you have to feed your your baby with breast milk. I personally started in the OT. In normal delivery, after the patient is delivered, we feed the baby, and only then the baby and the mother are allowed to go out. And in a cesarean, it is done right away, because that is the time when the pediatrician is waiting. The pediatrician takes the baby, they'll wrap the baby and bring and give it to the mother, and then the baby is breastfed. So, what is a breast call? You should see it on YouTube. If the baby is left on the abdomen, very slowly, there is a video of Maharashtra. So don't think only foreigners' babies can do it. Our babies can also do it. Everybody, feeds in the same way. So in a span of 13 minutes, without any support and guidance, the baby reaches the mother's nipple. That is called the breast crawl. So if the baby stays with you, rooming in, naturally more milk will be produced. If you are wrapping the baby and giving it to your mother or your mother-in-law or your husband and you're sleeping alone, yes, your milk quantity and quality will be compromised. Okay. And baby crawls to the breast and latches themselves, takes 30 to 60 minutes. That is normal and perfect. The baby will have 2 sips and go to sleep. 2 sips. Not that they're tired, they're actually very contented that they're with their mother. And then bringing the baby close to, your body, skin to skin contact makes the baby feel very, very secure. So there are 4 golden positions: left breast, right breast, lying down, or you can take the baby from the side also like this. Okay. We don't encourage lying down breastfeeding, because sometimes in that the mother goes off to sleep and the baby can aspirate, or because the baby has a very small nose, वो उसका नाक दब जाएगा, वो सांस नहीं ले पाएगा. So we don't encourage late के breastfeeding. You have to be aware, sit up, breastfeed your baby. I understand. We women have to go through so much. Your cesarean is done, and after a few hours we say, feed the baby, take turns, get up. 12 hours you should be walking, standing up and all that. Any other surgery, if the man has to go for surgery, 3 days he will not move from the bed. But in 3 days a woman is expected to do everything. And it is important, the sooner you move, the better the healing. Okay. And we must understand the milk also, the foremilk and the hind milk. When you're feeding, make sure that you empty your one breast completely, and then feed the baby on the other breast. So take turns, once this and once this. So the first initial feeding, we say don't give the baby water for 6 months. The initial foremilk is mainly water and lesser of milk quantity. And the hind milk is the thicker, creamier portion. So when the baby is thirsty and it drinks the foremilk, his thirst is quenched. But to quench his hunger also, to fulfill his hunger, in fact, the baby has to empty the breast so that he gets the hind milk and proper nutrition as well. And this hind milk is important for brain growth because it has fat. And for you girls also, it is very important to consume milk and desi ghee so that you also have enough fat for your own nerves and your joints as well. Milk has lactose, and lactose will give the baby energy. It's a little bluish tint, and the hind milk is white or yellowish. One breast or two, I said take turns, okay? And never watch the clock. Watch your baby. Some children will suckle for 5 minutes and sleep. Some will do it for 30 minutes also. So there's no time bound that you have to feed for 15 minutes or 20 minutes. No. Each baby is different. No. And it depends on your milk production also. The more you feed, the more milk will be secreted. And God is great. Whatever is your baby's appetite, that much of milk will be secreted. It is basically supply and demand. So it keeps producing. It is called the HPO axis, hypothalamus pituitary ovarian axis. So HPO axis is working, and that is what causes the release of prolactin and the milk letdown. So the golden rule, remember, more feeding, more milk. It's happening automatically. There's no button that we can press. Now the baby will empty the breast. It will send a signal to the brain that produce more milk will be produced, and this cycle continues. So the first is reality check. Day 1 and day 2, the baby's stomach does not expand at all. So if you think you're going to give 1 bottle of milk, it will be overfeeding for the baby. So the baby will burp, the baby will vomit. No, it will definitely throw that extra milk out. So 5 to 10 ml or 2 to 10 ml size of a marble. Marble is really small. And I said, घर में एक अंदाज कर लेना छोटी वाली चम्मच, चाय की चम्मच, teaspoon. Then from day 3, the stomach starts expanding. So that is the time the baby needs 30 to 60 ml feed. That is a ping pong ball size. And by day 7, but you can't measure your own milk. If your baby is drinking milk and sleeping, the baby is happy and full. Nobody sleeps hungry. But yes, at night, the babies do wake up. That is their waking up time. 11 p.m. to 5 a.m. is the normal time when they get up. Don't think that the baby is crying all the time because the baby is hungry. Baby has other reasons also to cry. That night, don't think that the baby is hungry and give the baby top feed. After you give top feed, it'll be like, you overeating. After overeating, you can't do anything. You'll just, I can't breathe. I can't breathe. The baby is also in the same condition and the baby will go off to sleep. And you will feel that the baby was hungry. We gave that milk. Now the baby is full. That is why the baby is sleeping. No. You have loaded the baby with extra milk. That is why the baby is sleeping, and that is very, very risky. Very, very risky. We have even seen cot deaths when the babies are overfed like this. Okay, the baby will burp, मुंह में उसके दूध आता है, वो lungs में चला जाता है, वो aspirate कर लेते हैं, and then the results are definitely not good. So now UNICEF and WHO, they say there are 10 steps to success. Because it is not going to be easy. Everybody will say that you don't have enough milk, give top milk, blah, 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 so many advices. And even you will tend to believe that because you can't see on your own that how much your baby has drank. But don't give in to all that. Be comfortable. What you're already doing right now, this knowledge will help you to breastfeed your baby then. That is the day when you have to think about magical pregnancy, and magically your milk will be produced if you follow these small little things. So learning how to breastfeed, Planning skin to skin immediately after birth. Practice the right position of your baby. Keep a pillow in your lap and hold the baby and take support on a chair or a sofa or a bed and sit comfortably. If you're not keeping that, then you'll be bending down like this and your back will start hurting. So it is important to sit straight, and please don't watch any mobile or anything else. Don't be distracted because this is very, very important. Planning exclusive breastfeeding, you have to take a sankalpa for yourself that I am going to exclusively breastfeed my baby only for 6 months. Nothing, no water, nothing. Now, understanding rooming in that the baby stays with you. बहुत सारे डायलॉग सुनने को मिलेंगे क्या सर तुमने बच्चा पैदा किया है, हमने इतने बच्चे पैदा किए हैं, बच्चा वहां रहेगा, तुम आराम से सो. जनरली मदर्स हैव मोर ऑफ दिस कंसर्न. एंड सास को भी ये होता है मेरा पोता है मेरी पोती है तो हम उसको लेके सोएंगे. आई अंडरस्टैंड एवरीबडीज इमोशंस, आई रिस्पेक्ट एवरीबडीज इमोशंस, बट व्हाट इज इंपॉर्टेंट फॉर द बेबी इज मदर के साथ सोना, क्योंकि वो बच्चा सिर्फ आपकी दिल की धड़कन पहचानता है. ओके, सो वंस द बेबी इज विद यू, जब उसको भूख लगेगी ना वो खुद ही ऐसे 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 करके आएगा ना, तो यू विल अंडरस्टैंड द बेबीज क्यूज. वी आर नॉट ब्रिंगिंग अप पेट कि एवरी 3 आवर्स घड़ी देके फीडिंग करना है. नो, you have to take the cues. You have to give the cues. Avoiding bottles and pacifiers. प्लीज नेवर गिव योर पैसिफायर्स. आजकल वो क्या है, वो फोटो शूट्स करते हैं बच्चे का, उसमें वो पैसिफायर्स दे देते हैं कि पैसिफायर देंगे तो अच्छा होता है. नो, व्हाट हैपेंस इन द पैसिफायर इज देयर इज अ लॉट ऑफ सलाइवा सीक्रेटेड और बच्चा वही सलाइवा पी पी के उसका पेट भर जाता है. सो द चाइल्ड इज नेवर हंग्री. तो उसके मुंह में प्लीज डोंट गिव अ पैसिफायर एवर. एंड finding support. Your family is there to support you. In the hospital, your doctor, your nursing staff is there to help you. Please, nurses also don't have patience. They say, अरे आपको दूध नहीं हो रहा है, डब्बे का दूध पिला दीजिए. And as obstetrician, our biggest problem is with the pediatricians. They say, no, formula feed दे दो, कोई problem नहीं है. Please don't do that. Now, how will you know that your baby is hungry? वो साइंस देगा. होठ चाटेगा, it will stick the tongue out, हाथ को खाएगा, rooting in wherever it is being touched, it will turn like this, it will get restless. Now, if he doesn't get breast milk by now, then he will start crying, agitated, red faced, and when you give him feed, he will not take it. Now it is his turn, nakhra karne ka, "Arey, you didn't give me." They don't even wait for a minute. I'm hungry now, I want it now. So breast milk is the easiest thing. You just open it and feed the baby. Now there are certain common problems, and let's see some solutions also. We have to be prepared for the challenges as well. No? Sore nipples is very, very common. The commonest reason for a sore nipple is a wrong latch. 99%. The latching position is not fine. First, you have to be comfortable. Second, the baby has to be comfortable. Then automatically the baby will latch. There's no big science involved in that. Animesh, ये मेरा बैटरी डाउन हो रहा है, प्लीज ये लगा दो तो.
आपका बैटरी डाउन नहीं हुआ है.
हाँ, लैपटॉप का. यस, या सडनली शोइंग लो बैटरी.
आपके बैटरी का हुआ है.
Now, apply. It came, it went. It's not charging. There's some issue. Yeah, thank you. So what you need to do is find the perfect latch position. When the baby is comfortable, no, you will obviously know, and you will be able to feel the milk let down. वो movement होता है ना, वो feel होने लगता है. Now, if you have not been breastfeeding your baby completely and not emptying your breast completely, now God has made this like a pitcher. It will become hard and stony hard. You might even have fever, And because it becomes stony heart, sometimes there could be mastitis, that is, your breast could have infection, and sometimes there could be pus formation also, and that is very, very painful. If there is pus formation, then we have to, give a nick in your breast and release all that pus. It is very, very painful, and we'll put long gauze with betadine in your breast, and that dressing will go on for about a month or so. So if you want to avoid all these things, make sure that you are exclusively breastfeeding and make sure that your breast is emptying completely. Or one very important thing now, abhi se hi, whatever stage of pregnancy you are, take some oil, apply it on your breast and do massage towards the nipple. So ऊपर है तो ऐसे नीचे होगा, नीचे से ऊपर करेंगे, इधर का, and apply coconut oil or desi ghee on your nipple so that all the dead skin from the areola and the nipple is gone. Now, there are a few patients who have low milk supply, very few, just 1%, just 1%. No? So if your baby is passing urine 6 times a day, it means the baby is full. Okay? यदि वो उसका पेट नहीं भर रहा है तो वो यूरिन पास नहीं करेगा. Okay? And if the baby is gaining weight, it is fine. First 3 days, the baby loses a lot of weight क्योंकि बच्चा पानी से आया है. And then for a week, it stabilizes and it actually starts gaining weight only after 15 days. So don't worry कि नहीं मेरे को दूध कम हो रहा है इससे मेरे बच्चे का weight loss. That is absolutely physiological. And feed more frequently, check your latch, rest more, eat more, and stay hydrated. After delivery, you have to drink at least 300 ml of extra water, so that is used for your extra milk production. A dehydrated mother will not have enough milk. Okay? Because whatever water is there, the body will utilize it for its own survival. And some mothers who have this issue can have fenugreek, fennel, and cumin water. तो आप पानी में उबाल के ले सकते हैं, इनके लड्डू भी ले सकते हैं, मेथी, सौंफ और जीरा. These things are known to increase milk quality and quantity. If you have flat or inverted nipples, आप please अभी check कर लीजिए. Just rub your nipples a little bit and you will see your nipples have become erect. If you have flat nipples, please get in touch with our team. I will tell you what should be done. Now, beyond nutrition, there are lots of benefits for the mother and for the baby. Now, the baby ka kya hai? I said earlier also, breastfed infants have better IQ. There are fewer infections, allergies, and diseases. Jaw and teeth development is also perfect. Bottle-fed children have, उनके दांत बाहर निकल आते हैं, then later on they'll need a dentist. Orthodontics treatment will be needed. Now, emotional security and bonding is there for the baby. Yes, imagine, when your mother hugs you, even at this age, you feel so good. And that little being, it knows nobody and it has come from such a tight space. So it knows only the mother. So the mother just holding the baby itself will give the baby emotional security. And this security will make your baby a better learner. Life में, school में जब वो जाएगा, he will be able to get things better. Why? Because he has that thing of feeling secure in alien environments as well. There's reduced risk of obesity because we are not overfeeding. बच्चे को जितना चाहिए उतना ही पी के वो breast छोड़ देता है. How much ever you try, I think he's not full. He will not take it. But when we make milk in the bottle, okay, he's had only 30 ml, I made 60 ml, बर्बाद होगा. Will pee. रोएगा मुंह खोलने के लिए तो गटाक, आंख बंद करो गटाक. That's very wrong. That would be such a trauma. And for the mother, there are lots of benefits. I take your guarantee. If you breastfeed for 1 year, you will come back to your pre-pregnancy weight. You don't have to do any exercise, dieting, nothing. But control portion eating. You can't have so much and say, ma'am, I'm not losing weight. Huh? So it reduces postpartum bleeding, lowers the risk of ovarian and breast cancers by 25%. And that's a huge risk reduction. And no bottle preparation at 3 o'clock in the morning. And the bonding hormone, the oxytocin, it makes the mother feel happier. Now, a prepared mother births powerfully and feels abundantly. Now, your body is designed for this. Garbh Sanskar also says this, and modern science also confirms this. 85% of women can birth naturally. Preparation reduces interventions by 50%. If you know how things are going to be, like in our advanced course, we take a session on trip to the labor room. So we take you through that journey. That once you go there, what will happen, and how things will progress. So if you're mentally prepared, things will be so much easier for you. It'll be like knowing the question paper. And your body produces oxytocin and endorphins. These endorphins, they actually fool us. The moment we deliver a baby, we forget the pain. It's gone, and it's gone forever. And then again, after a few years, we are prepared to produce another child. So that pain threshold is gone forever. That is what endorphins do. Now, what we are preparing? Your body, your mind, and emotionally also. How to connect with the baby, how to be fearless. No? So we want your mindset to shift basically. I have to endure labor. Instead, I get to meet my baby. So there's a lot of difference in the thought, no? So how do we master these? We empower your birth experience. How? By breath. We'll teach you, no? How to breathe, your movements, your yoga, and all those things, and your mindset power. Now, by doing the right kind of things at the right time, no? What exercises, what yoga has to be done, your labor would become shorter and easier. I said there's no labor pain, there is labor pleasure. And my department is the only department where we will give you injections to increase your contractions and increase your pain. The other department, if you go and say, I have pain, they'll give you an injection to, subside your pain. And everybody wants this pain. Happily. मैम टर्म हो गया है, दर्द नहीं हो रहा है. So कभी कभी दर्द भी अच्छा होता है. So why movements happen? It helps your baby because of gravity to descend. In certain villages, even now, women sit down to deliver and the gravity helps. And when you're moving, even in your labor, in the first and the second stage of labor, it reduces your pain by 30 to 40%. It shortens your labor by 1 to 2 hours and you stay in control. During our sessions, we even teach you Kegels exercises. The pelvic floor muscles will become strong so that you have strong and flexible pelvic muscles. That way your birth will be better and the recovery will also be easier. Now we advise perineal massage also. What this does is it reduces the chances of tearing of the pelvic floor muscles by 50%. How we have to do this? And you can start this as early as 34 weeks. Wash your hands, chop your nails, use coconut oil or olive oil, and put your thumbs in the vagina and apply pressure downwards and sideways. Hold the pressure for 60 seconds and repeat. Now we have 4 stages of labor. The early labor, it's the longest but easiest. The cervix will dilate till 4 centimeter. And this is a time when the patients start coming to us. There is a vague kind of discomfort. I'm not comfortable. Then when we do a per vagina examination, we'll see the dilatation, how much the dilatation is. We'll check your contractions also. Most of the times, this is a time when the patient is uncomfortable and they're at home only. So we advise, if you are in this state, stay at home. There's no need to panic and rush to the hospital. Rest, eat, drink, use the birthing ball, watch movies, practice breathing, and wait to go to the hospital. Now, in the second stage, Active labor. This is the time when the contractions will increase, the pain will increase, and you need to go to the hospital now. But don't panic again. Control your breath, your movement. And now is the third stage, hardest but shortest. After 7 centimeters, the contractions become very, very strong and the duration also reduces. So, this is the time when you are in the hospital and we will ask you when you have to push. Do not do anything on your own. Now, once you're fully dilated, that is 10 centimeters, then in this state, after full dilatation, in 20 minutes to 2 hours, you will deliver. The best thing is once you're fully dilated, you don't have that intensity of pain. It is just contraction. So you can feel your contractions coming. And when the contractions come, we'll ask you to push. And once the baby is out, we'll place the baby on your abdomen. And if you cooperate, and if the doctor is also following that, then you can do the breastfeeding as well. Now, what to expect and how to thrive. After you are home, remember the baby will sleep for very, very long hours, 16 to 20 hours. Some children even sleep for 22 hours, so don't panic. And their feeding needs 8 to 12 times per day. Yeah? They will cry. They're learning to communicate, not that they are sad and not that, they are in pain or anything of that sort. They will poop and pee constantly, and that is a good sign. And they want to be held all the time. As long as they're in your lap, they'll sleep. The moment you put them on the bed, they will start howling. And I said 11 p.m. to 5 a.m. is their time. Simple logic. They've come from the total darkness itself. And in the universe also, there is total darkness at that time. No? And I know you will be exhausted. So sleep when the baby sleeps. You will have bleeding for about 40 days. That will reduce gradually, but then you will be, using some kind of pads. Maybe when you're so exhausted that you might want to even cry. You might have sore nipples. You might feel that overwhelming love sometimes. And sometimes you might feel, what? I was so happy when I was alone. Maya got married and then Maya wanted to have a baby. Those kind of feelings can also come, which is perfectly normal. Don't worry. Your job in the first month is to feed the baby. Number one, it is you who wanted the baby. So don't depend on anybody else to give top feed to your baby because you want to sleep. No? Then you take care of your sleep. When the baby sleeps, you sleep along. You need time to heal. So that rest is important of 40 days and bond with your baby. Talk to your baby. Breastfeed your baby, hold your baby, cuddle your baby, everything. And remember, first week is survival mode. You will not even realize what is happening. You'll be so lost. You practice everything, but that is a time when you need to do things and trust your preparation. Now, after delivery, eating the right kind of food is also very important. Many people think that we'll have some boiled stuff and khichdi. No, 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 no. Even if you have a cesarean, after 1 week you can have complete meals. No? Salad and fruits. From third day onwards, we normally allow home cooked simple meals. But after 1 week, you can have everything. The protein, iron, fruits, water is very important. 10 to 12 glasses daily during pregnancy and even after delivery as well. So you have to start eating all these things during your pregnancy and continue postpartum also. Now, for milk production, you think after the baby is born, I will start eating, things will happen? No. You have to start eating and continue later on. So a little bit of methi seeds, soft, cumin. You can add all these together and make a drink, or you can boil them separately and drink. Then oats are very good, almonds and dates are good. The most important thing is desi gai ka ghee. Jaggery is very good, and dry fruit laddus are also very good. So this is an ancient recipe. You can take a screenshot of this and see how these laddus are made. Now, what you have to avoid is junk food, too much of caffeine because that is very dehydrating, and alcohol and smoking. So, what is important? Eat well, birth well, and feed well. Now, you have to promise yourself, I commit to practicing daily. I commit to trusting my body. I commit to releasing fear and embracing power. I commit to being the mother I know I can be. I'm ready for this magical journey. And we have something very, very special for you all today. Another offer because you all love me. I also love you. Okay. I don't want you all to go away from me. And I'm sure many of you would want to continue this journey with me where you can meet me every day. So, Nikki, Nikki is here to tell you how you can meet me every day.
Yes, Didi. Thank you
I
so
want to hold
much.
your hand and take you forward. Yes, over to you.
Hello, mamas. How are you all doing? We are meeting after a long time, I guess.
Very
After a
nice.
week or so. So let me share my screen just a minute. Hello, everyone. Nice to meet you all. Thank you for turning on your camera. Ritu Parnaji. Thank you so much. Nice to meet you all. So, mamas, recap. What did we learn in the 5 days? And many of you, I think I'm new to some of you. So let me introduce myself as well. I'm Nikki. I'm a meditation facilitator. I'm curator of this magical pregnancy program. And I work on the behind the scenes. I'm also a Gat Sanskar coach, all those things. And I'm in charge of mental wellness for all of you. And the magical uh, journey of pregnancy itself, not the course. I don't need the course, but how mamas can feel stress free and magical throughout their pregnancy journey. So that is my main focus, and that is what I'll be focusing on today as well. So, what are the 5 days we learned? First, we learned stress free pregnancy, how we can make our pregnancy stress free. And day two, we learned how we can have a good Ayurvedic nutrition, wholesome meal, how we can incorporate it for our health and our baby's health. And with the day three was the yoga part, how to empower your pump. And day four was a super day. We learned to activate our star baby activation system for our super smart kid. And day five, it was so amazing, the collective nurturing, right? So we discovered all these 5 days. So we have unlocked immense wisdom in just 5 days. 5 days was equal to 5 plus magical learnings. We all learned so much immense knowledge. And you must be wondering, how did these 5 days feel like? Right? Did you make it feel more calmer? Did it give you more clarity? Did it bring you more connection? What was the experience that you had in these 5 days? Can you all put it in the chat box, please? A deeper bond, clear understanding of your body and your baby's needs, a sense of peace and calmness. What was your experience in these 5 days?
For me,
Hmm.
generally my mood, because
Okay.
I am very much mood swinger happening, but right now I conscious these things, so these things change.
That is so nice, Rituparnaji. Very good. That is the transformation. Very good. Learning. Very good, Priyankaji. Yes. So, mamas, how many of you would like to experience this at an even higher level, a committed level? so that you have felt the calm and connected in these 5 days. But there is another level of commitment, a higher level of commitment. Yes, Pavitraji, very good. How many of you would like to experience that? Give a thumbs up. Yes, yes, thank you so much. So, mamas, let me explain a simple concept. There is a ripple effect for your well-being. Okay? When you are calm and happy and have positivity, that results beyond what you can imagine. For example, it starts with you. For you, you experience reduced stress, enhanced emotional balance, and a profound sense of inner peace. And that calmness is transferred to your baby. They foster optimal fetal development and create a nurturing environment for your little one, right? And that results in your support for a smoother, quicker, and most positive recovery experience after birth for your postpartum, right? This is all interconnected. So where does this all begin? Within you, from you. When you are very stress-free, when you are feeling that calm, when you are emotionally stable, when you have that clarity. That is why it is very important for you to be calm and centered, right? And when you are calm, you also release good hormones, and that results in very good organ development of your baby. And that is why everyone says you to be very, very calm during pregnancy, right? And when you practice daily well-being, the quality of your night sleep will be truly amazing, right? How many of you experienced this sleeping better? So already these 5 days. 5 days sleeping better? Yes. Yes, Janvi ji, Pavitra ji, Meenakshi ji, yes. That is the power of this. When you are calm, you get good sleep. When you have the knowledge, when you have the confidence, yes, Meenakshi ji, very good, yes. That is why we tell you to practice these every day. And the truth is, Garbh Sanskar is not just a 5 day course. Definitely not. It is a daily environment. Babies get shaped by what the mother feels every day. I don't have to explain a lot on it because you already gained all the knowledge in these 5 days. Let me share a very short example. You all know the story of gravity, right? Isaac Newton sat under an apple tree, and when an apple fell down, he thought, why is it falling down? And he said, okay, this is because of gravity. We all know that story. But do we say that gravity was discovered only when the apple fell down? No, right? Gravity was present even before that. Gravity was there the whole time. But it was humans, when we discovered at that particular point, gravity was there. Right? So that is the difference here also. Garbh Sanskar is same like gravity. Garbh Sanskar is there. Everywhere it is there. Even I'm talking and your baby listens. And your baby can recognize me after birth. Right? It is present. It is just that we are realizing it right now. Even you practice it or not, Garbh Sanskar is always there. It is just that we realizing it and practicing it and giving the baby the right daily environment. Right? That is why Garbh Sanskar is important. You already know all of these, but I'm making it very sure so that you follow it every day. Okay? So, mamas, you must be wondering why most pregnant mothers fail to stay consistent. We all learned all these. Yes, Meenakshi ji, very good. We all learned how all this is very, very important. But most mothers fail to stay consistent because they are doing it alone. They get conflicting advices and emotional shifts and no daily guidance, right? So all these come at a very huge price. There's a huge price for inconsistency because pregnancy is a one-time window for your baby's brain, body, and emotional development. If you miss it now, you can redo them for your next baby, but not for this baby, right? Every minute in pregnancy, every day in pregnancy is crucial, and you already learned how important it is. Let me share a very short example. This is a real story. We have just changed the name. We are not revealing the name for sure. Let us take the mother's name as Priya. Okay? She joined all the sessions and she loved them. She told, I have planned to chant, talk to my baby, eat mindfully. Everything I planned perfectly every day. I will be giving this particular time a day. Exactly. She fixed it at 7 p.m. Okay. 7 p.m. was her time. She fixed it at 7 p.m. She told that, and I'll be staying consistent. But days passed. 7 p.m. became 7:30. That became 8, then 8:30, then 9, then the next day, the next day, the next week. Then it never happened. She kept postponing, right? So the intention here was good. Her intention was good. She wasn't careless or lazy, but she was alone in the process without any fixed time, without a guide waiting, or not a consistent rhythm. Because it's easy for good intentions to fail. And in pregnancy, by its very nature, doesn't wait. And with a lot of mood swings, it is very important to stay consistent, right? So that is why we told you what to do in the last 5 days. The 5 day Garbsanskar bootcamp told you everything on what to do in the last 5 days, right? But now, what if you did it all every day with a hand-holding support system? That'd be great, right? With you having the support every day, right? So we all invest in amazing things, luxury vacations, toys, birthday parties, all those things. But we fail to realize that the true gift for our baby, the true investment for our baby, lies in the foundation for the future, for the lifelong well being. And this is the most crucial investment. And that investment arises with often hesitation. And many mothers, we need to have that where mothers feel that the power of Garbh Sanskar, where it is truly a blessing which helps in the future as an investment, right? So, Mamas, this program is not for everyone. It is exclusively designed for mothers who are truly committed to nurturing the very best future for their baby. Okay? So, let me repeat that again. This program is not at all for everyone because this is for mamas who truly want the very best because this had all the knowledge that it wants to have. That is where we step into the magical pregnancy golden motherhood journey system. So this system is a foolproof 5-step system to make your pregnancy magical. So how does this work? A foolproof 5-step system. So it starts with a step 1 where you get a personal nutrition guidance, a live one-to-one consultation every month with your doctor. An Ayurvedic doctor will be there and she will be doing a very deep assessment of your Prakriti. So what is Prakriti? You touch the basics in the nutrition session, I guess. The Prakriti is you have different Prakritis, Vata, Pitta and Kapha, and those keep changing. And based on that Prakriti, you'll have to modify a lot of lifestyle changes, food habits, and all those things change based on that. So that is Prakriti. So she'll be assessing your Prakriti, your trimester status, your cravings, your symptoms, your health, weight, BP, digestion, all those things. And she will be giving you a morning, evening pregnancy routine and portion structure, natural remedies to boost your immunity, and supporting treatment for any complications with the right food. Because we Indians know with the right food, we can cure many, many problems in our life, right? That is why it is important to have this. So you'll have a monthly nutrition support. And your step 2 comes with a Monday to Friday live classes every day. So 30 minutes a day, 8:30 p.m. to 9 p.m. IST Indian time. So master whatever we have covered in these 5 days. So Garbh Samvad we learned. So deep baby bonding, stimulating baby's brain. For Garbh Sangeet for activating baby's creativity. Garbh Acha, the lifestyle content. And you'll be building your foundation. Activate baby's fullest potential. So you learn what all to do. Right? You learned what all to do. So here you'll be doing along with a lot more deepful insights. A very deep hand-holding support. So what will we be doing every day? Everyday classes? Oh, same, just 5 topics? No, not at all. We have a lot more things. So those daily live classes from Monday to Friday will have lot of sessions like sound healing for brain and heart development, pranayama for babies' oxygen, lung capacity and stress-free pregnancy, Vedic storytelling and moral intelligence activation, Keetan and Bhajan night, the emotional immunity and peace, brain boosting games for the left and right brain activities for the womb, affirmations and baby programming practices, emotional cleansing routine to release fear, anger, and anxiety, prenatal visualization to see your baby growing with intention, and the sacred pregnancy scriptures, Garbh Upanishad, and stories for conscious parenting, all those things. So here we have listed a few topics here. So there will be hundreds of topics covered. So there are the daily sessions, so there will be hundreds of topics. So we can't put all the topics here. So this is just a glimpse of what all topics will be covered, how the sessions will be. Right? So this is just a glimpse, not all the topics, okay? So this is your step 2, your daily live classes. And what is your step 3? Now we did for the mind, now for the body, right? So there will be weekend prenatal yoga, 7 a.m. and 5 p.m. There will be live classes. So there will be trimester-wise guidance and for strength building, posture correction, birth preparations, hip opening, stamina, and breath training as well. So here, mamas, we need your pregnancy scan reports, your medical reports. Everything needs to be shared with the yoga instructor so that she will be guiding you personally based on your medical history. So be prepared. We need a photo of that. All reports from first to last. Whatever you have, all the reports, please share it with the instructor. She is also a doctor, so she knows very best to how to guide you. Okay, so she'll be guiding with your personal prenatal yoga, trimester wise. Yeah, and you will be having empower and regenerate yourself every week so that you and your baby will grow stronger, calmer, and more prepared for birth. And step 4, you'll be unlocking your child's potential with pre-recorded challenges. So these challenges include mantra healing challenge. So mantra healing challenges harnesses energy and infuse positive vibrations to help boost baby's creativity and feel calmer as a mother. So that you'll be having Bhagavad Gita wisdom, explore the timeless wisdom for mothers to help install values in the baby, and the Vedic maths for a star kid. So this will stimulate mathematical abilities from within the womb to help unlock problem-solving skills in the baby. So these are power-packed pre-recorded challenges. So you'll have mantra healing, Bhagavad Gita, and Vedic maths. So these are 3 separate challenges. So you will be getting those challenges as well. And step 5 is your womb magic accountability system. So we heard the story of Priya, right? She was not able to stay consistent. And that is where this system, this step falls in. So you will be having a personal care manager, your guide and go-to support. She will be there assisting you, checking you in, your weekly progress check-ins, everything will be tracked, and she'll be taking actions, improvements, and what are challenges, she'll give you solutions for it. And she will act as an instant support channel so that you never get stuck and are always guided. So this full 9-month hand-holding, we stay with you until the baby is born, and she will be there to assist you. Whatever problem, whatever concern you have, she'll be there with you. So you focus on your baby and enjoy your pregnancy bliss, and we will take care of the rest. So no tension for you at all. So we take all the tension. Right? So this is your all-in-one magical pregnancy system. The 5 steps, 5 complete steps covering every aspect of your journey for 9 months, full pregnancy support, and one sacred system, everything you need in one place. So many of you, and how many of you would want to be a part of this daily golden mama club, right? So this is an amazing club where it will be fun and we'll be interacting with many other mamas. Yes, Meenakshi ji. Hi, mamas. There is a difference between wishful thinking and commitment. Wishful thinking is, I want this, right? I want this. I want all of this for my baby. I want to have this good future, good education, good schooling, good everything, all this. But that wishful thinking only comes true when you are committed, when you are dedicated right from today, this second. We have already seen your commitment for the last 5 days. Very good for that. Big round of applause for to all of you for that commitment. But it doesn't end in 5 days. It goes through for the 9 complete months. So we want that dedication from you. So please stay committed so that you are giving the best foundation for your baby, right? And again, this program is not for everyone. I'm repeating this again and again because it is exclusively designed for mothers who are truly committed to nurturing the very best future for their baby. And if you could provide the best womb environment, scientifically backed nutrition, guided meditations, and daily Garbh Sanskar, all without feeling stressed, without Google confusion, without being alone, without any pressure, would that be worth for you? Right? That is the true blessing for any mother, right? So, mamas, your 9 month daily golden motherhood journey consists of your personal nutritionist, where you'll get every month, and your daily live Garbh Sanskar classes, and your weekend prenatal yoga classes, 7 a.m. and 5 p.m. We have 2 batches, you can join anyone or both the batches as well. And your mantra, Gita, and Max recorded challenges so that you get the sacred nourishment, right? And your personal care manager, your dedicated support system, where she follows up every minute for you. She's there with you, always supporting you and guiding you. And mamas, before we talk about the magical pregnancy as a program, I want to take you a little back to why this journey actually began. When we started our work, we didn't start with about pregnancy. Of course, Sankariti was there doing all of those pregnancy, and I was conducting meditation sessions, all those things were there. But we were working as volunteers with one simple intention to contribute to a peaceful, non-violent, happy world. A world where people can live without fear, without hatred, without constant conflicts. And while working on this, one realization slowly became very clear to us. If a person becomes violent or disturbed in their 40s, it is very difficult to change them back. And in their 30s, it is little easier, right? And then in their 20s, it is even easier. But when we look deeper, we understood something powerful. The earliest stage, childhood, infancy, that is where real transformation begins, right? And then we asked ourselves one honest question. If values are formed after birth, why not begin even before birth? And that was the moment everything shifted. That was when Dr. Anita Didi planted the very first seed of this vision. She showed us scientifically, emotionally, and spiritually that it is possible to influence a child's values, calmness and intelligence, and emotional stability from the womb itself. And suddenly our purpose became very, very clear. We were not just preparing mothers for delivery, we are preparing human beings for the world. Children who are peaceful, with strong values, who are emotionally balanced, intelligent, and grounded. Because when such children grow up, they don't just live in the world, they lead it. They bring clarity. They give the direction to the entire world. And that is how magical pregnancy was born, not as a course, but as a mission. A mission where every mother becomes the first teacher and every child becomes a contribution to world peace. And that is why even today we don't think first about price. We think about the impact and about the kind of children we are bringing into this world, about the future we are shaping. And because of this mission matters so deeply to us, today we are opening this journey not at this wholesome price, not at this price of your daily pregnancy support. All of this, if combined, we know that it comes up to this much. And that is how everyone is doing today. But because of the mission, we don't want to keep that, right? And because of that, we want this complete system where if purchased individually, we know that not because the value is less, but because the purpose is greater, Because if you feel this calling, if you believe that your child's journey deserves conscious care from the very beginning, this is the next step. It's not just an enrollment, this is the choice of your future. And this is why we have this amazing bundled everything at a very special gifted price for all of you at just 5,000 per month. And many of you mothers would be wondering, yes, Janviji, you can get this, all of this at just 5,000 per month. And all of this, your personal nutrition, your daily Garbsanskar live classes, your prenatal yoga, your mantra Gita, and max record challenges, your personal care manager, everything comes up together at just 5,000 per month. And some of you must be wondering, what is the difference between, some of you have already enrolled for the 9-month weekly hand-holding system as well. So some of you must be wondering about what the difference is between both of that. So let me share that as well. Timothy is wondering, I'm not all, I'm not mentioning all here. So some of you have already joined the 9-month weekly handholding system. So you must be wondering why this, right? So what is the difference between both the systems? So in the 9-month weekly handholding system, you get a consultation with the doctor, you get a 5-day advanced Garbsanskar boot camp, and you get a weekly live handholding sessions, right? Weekly sessions happen. And postpartum care, the Mama's Place special box, everything happens in that weekly system. And this one is a daily hand-holding system. So that is the difference between both. So there is a monthly personal nutrition plan with the Ayurvedic doctor, your daily Garbsanskar live classes. So these are daily classes, all day long. So those were weekly and these are daily classes. So that is the difference here. So we can pay to yoga classes, the challenges, and you also get your personal care manager. So that is the difference between both the systems. And suppose for those who have already joined the 9-month weekly handholding, so this is the difference between both the systems. And mamas, you must also be having another question here. So what if, how much I should be paying and all those things? Let me share that also again here. So this was all you get. So how much is that for monthly if I'm paying? How much is that? So this was the original price and you get a discount price of flat 50% off. So you'll be having the 5,000 into the number of months left in your pregnancy. Whatever months you're left in pregnancy, that is you'll be multiplying with that. So which will be costing you just 160 or approximately 160 rupees a day, which is not even the cost of an ice cream or a coffee and a fancy restaurant, right? So that is what you're gifting to your baby. So example, if you are in the 6th month, you'll be like into 5,000 into 3, right? So if someone took responsibility for your daily well-being, would your pregnancy feel lighter? Would your confidence increase? Would your baby feel safer? These are the questions we want to ask yourself right now. And why you need this daily care? Because doctor meet you once a month, right? And reports come occasionally. But your mind meets your baby every single moment. And this shapes the emotional and cognitive landscape through your daily thoughts and feelings. And that is why you need your daily care system. So 9 months of being held daily and never feeling alone at all. So you unlock immense wisdom. But how much did you actually apply? You learned all the wisdom in the last 5 days. But did you all really apply that? And that is where this golden motherhood journey begins. The complete pregnancy journey, if you want, you can also take this for just a month. So if you want to take it only for a month, it will be costing you 7,000 rupees. So you are also welcome to take only the daily Sanskar live classes. So Monday to Friday, you can opt for this by contributing 3,500 per month. So the whatever feels right for you, for your baby's future, you can do that. So choose the system that fits your journey. So 1 month complete pregnancy, your contribution will be 7,000, and your complete pregnancy, all the system, 5-step system, your contribution will be 5,000 per month. And if you want only the daily live Garb Sanskar classes, your contribution will be 3,500 per month. So you can choose the system that feels right for you, and you can select your pregnancy month, which pregnancy month you are in, and if you want the complete pregnancy system, or if you want only the daily live Garb Sanskar sessions. You can choose according to your needs. Yes, Meenakshi ji, if you are in the 4th month, so if you want the complete system, it will be 4 into 5 into it will be multiplied into 5,000 into 6, so which will be your contribution will be 30,000. So you all know there is a lot of time and effort involved from each doctors, experts, and everyone here with the entire magical pregnancy team. So this is your QR code. You can scan this and you can pay. Yes, Chanviji, if you're in the 3rd month, then it will be into 5,000, so into 7. So we have 7 months left in pregnancy, so into 7. Right? So I'll be sharing this number also with you. So if you find it difficult to pay the entire amount right now, you can book this right now by paying 2,000. You can book this entirely by paying an advance of 2,000 contribution, and you can book this and you can pay it later. The sessions are running right now, so you can join from tomorrow itself, okay? So that you don't even waste a single day in pregnancy, right? That is the power we need to give all of you mothers. And this is the difference, as I already mentioned you. Some of you have registered for the weekly handholding. So this is the difference between the weekly and daily handhold system. So you get all of this entire motherhood journey. Yes, Chanviji, you can make the payment using GP. On that number I've shared on the chat, you can use that. Yes. So the entire magical pregnancy team will be with you. You already know Dr. Anita Chaudhary ji. There is no introduction needed. So you'll be having Dr. Minal Kotak ji. You are familiar with her too. And you'll have the Ayurvedic doctor, Dr. Rashi ji, Ankita Agarwal ji, and Ayush Agarwal ji, and myself. We all will be there with you, supporting you in each step of your pregnancy every day. The entire team will be there with you. So this is your system, your daily handholding system. And members, if you have any questions regarding these sessions, if you have any queries or doubts or any questions, you can also book your clarity call. I'll give you a link so you can book your clarity call and we will clear all your queries. Let me share that as well. Yeah, so this is your so if you have any queries, you can hello Janviji, welcome. You took an amazing step and we are so proud of you that you took a very good step here. Very good. Okay, Vinunji, if you are taking the daily classes, the complete system, so what all will be covered? Let me go back with my slides. So you understood this, right? You will be having a personal nutritionist and you'll have daily Garb Sanskar classes, and there'll be prenatal yoga, and you'll have the recorded challenges, and you'll have a personal care manager for you dedicated to you. And for the daily classes, there will be hundreds of sessions happening every day. So we can't put in everything. So this is the glimpse of what all will be covered in the daily classes. So it will be very powerful. It will be very powerful. So you don't have to think, what should I practice for my child this day? What should I practice for my child today? Am I doing the right thing or not? So everything will be taken care of. You just need to follow the instructions. And everything will be taken care of. This is a glimpse of what all will be covered. Every aspect of pregnancy, every aspect of Garbh Sanskar, everything will be covered. So it will be more of 30 minutes a day. 30 minutes a day. Meenakshi, credit card is not actually, we don't have that provision right now. So you can use the GPay or anything right now. 8:30 p.m. Minmunji, 8:30 to 9 p.m. Is it difficult for you to pay using GPay, Meenakshi ji? You can use this number. And if any of you have any doubts and you need a clarity call, you can book your clarity call here. Yes, Meenakshi ji, you can surely do that. Or you can do a pre-booking of by contributing 2,000 right now, and you can confirm it later. Or if you want to discuss, you can drop in your number so that we can log this for you. So these are the things that will be covered. I hope that answers Vinmunji. Yes, Mama. So any more questions? Apart from this, also you can ask any questions. So this is your amazing 5-step system. So which will have all of these. Yes, Mama. So any more questions? Apart from this, also you can ask if you have any more questions. You can put it in the chat box or you can unmute and ask. You need the QR code. Wait, let me share that with you. Okay, Meenakshi ji. Very good. So if you have booked it, please drop in your phone number as well, because sometimes your phone number, your GP number is different from your phone number if you're paying from your family or husband's number. So please share your phone number as well here. Yes, thank you, Meenakshi ji. Yes, Chanvi ji, can you drop your number as well? And Vinmun ji, you can also drop your number if you have any queries. Or if you have any more queries, you can book your clarity call here as well. If you have any queries apart from this also, please you can ask now, mamas. And mamas, there is another special surprise for all of you. This 5-day journey is not going to end here, not going to end today. We have another special session waiting for you all tomorrow. Same time, okay? So please book your time for tomorrow as well. So we'll be meeting tomorrow as well, same time. And we'll have a lot of fun tomorrow. So tomorrow is a surprise session. Same time. Okay, so this journey doesn't end here. It continues to tomorrow as well. Yes, mamas. Yes, thank you. Thank you, Meenakshi ji. Thank you, Vinmanji. You have a very cute name, Vinmanji. Okay, any more queries? Vinmanji, if you have any queries, you can drop in your number. We'll contact you. Any more queries, mamas? No? Okay, very good. I hope all of you have taken the responsibility, taken action, because all these 5 days we were focusing on taking action, right? So that is the very important thing. And regardless of you have registered for this or not, there will be support from us every single minute, every single day in your complete pregnancy journey. So wherever you're stuck in, just give us a call or messages. You know how to contact us. We are there in the admins. You can message us or contact us. And we are always there to guide you with any pregnancy queries, any support, any questions. Okay? So regardless of anything, we are always there. Thank you, Vinmunji. Your name is very cute. Yes. Okay. So, mamas, let us meet tomorrow again in an amazing session, same time. So until then, have a very, very good sleep, very happy pregnancy as well. Okay? Thank you so much, everyone, for joining in today. Let's meet tomorrow. Good night, everyone. Bye bye. And before we finish, I conclude by offering all the learnings and seeking blessings of the divine power. Let me conclude it in the same way, seeking the divine blessings for all my lovely mothers and surrendering everything to the divine power to be taken care of. Sarvam Shri Krishna Arpanamastu. Jai Shri Krishna. Jai Shri Ram. Hari Om. Thank you, everyone. Thank you for joining in. Bye bye. Happy pregnancy. Good night. See you all tomorrow.